Սիրելի բարեկամներ, իսկ այժմ սիրով մեր հեռուստաեթերը տրամադրում եմ դոկտոր Օհան Karatoprakին։ Ձեզ ներկայացնելու բժշկական օգտակար խորհուրդներ ձեր առողջության համար հերթական հաղորդումը։
Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV health program. This program is sponsored by Holy Name Medical Center. And today we have a very interesting program. It's very much in news, and it is about a virus that has been affecting many children in our metropolitan area as well as in any other many states. And it's called enterovirus 68D. And our guest today is Dr. Garbis Baydar, who is specializing in pediatrics and board certified in pediatrics. Dr. Baydar, welcome.
Thank you.
So we have this unusual viruses. We had decades of this virus, but somehow it's very active right now, especially among children. Do you see the enterovirus in your office?
Yes, I do. We've been seeing them for years, and enteroviruses there's so many different types of them, maybe more than 100 different strains of enteroviruses.
And the 68 is the common now.
It seems like, hasn't been that common, but it just was seen in August, towards the end of August, in Illinois and Missouri for the first time. And then it just spread throughout the entire country, and now currently we have reports of 40 states in the United States reporting
The enterovirus.
EVD68 virus.
What are the main symptoms that people present to?
It may start with cold symptoms like runny nose, aches and pains, and then they may or may not have temperature. Children tend to have higher temperature than older kids and adults. But the specificity of this EVD68 was infecting younger children and children with asthma.
What the parents should do if the kid has enterovirus? What should we recommend to parents? What kind of precautions should they take?
The best way to deal with this infection is to prevent it. How do you prevent any viral infection? The major way of preventing viral infection is hand washing.
Is it transmitted by cough or cough particles? It is airborne?
Enterovirus are not airborne. It's not like chickenpox where you are in the same room, you can catch it, but it's found in stool,
Right.
it's found in bodily fluids, it's found in sputum, it's found in
bodily
nasal
secretion.
discharge.
Right.
Yes, so person-to-person contact, and it lives on surfaces long enough, so if a child or a person with enterovirus touches the surface, someone else touches his or her nose, may get it.
So the surface has to be disinfected then, and as you said, the main thing is really after disinfecting them and washing the hands 20 seconds with the soap and water. So bodily secretion contamination is the main thing for
Correct.
enterovirus.
Correct.
So visiting a relative that has EBV68D virus, as long as they don't get contact with that patient, they might not get it then.
If they are in the same room, they are not likely to get it from that person, but giving hugs and kisses to that person or touching
Right.
the same area the person touched before and then touching one's nose or eyes, that's how you get the virus.
So now that we are talking about enterovirus, now let's talk about the flu viruses now, and the vaccination a little bit about the children and adults at the same time. So the symptoms of the flu we know, but I think we should go over again what are the presenting symptoms to the office usually when kids come with a flu infection.
We are not as concerned about the flu disease itself, but we are more concerned about flu disease complications such as encephalitis, brain inflammation, pneumonia,
Right.
which can be
Very detrimental.
which can be in some cases deadly.
So the prevention is utmost important in flu, and then we have vaccine obviously. So what age in pediatrics we start vaccination?
Flu vaccine we start age 6 months and above, and in most daycare centers in New Jersey, it is mandatory to have your child vaccinated. Otherwise, the daycare or preschool or
They will not
kindergarten
accept the
will
kid.
not accept them. Yes.
And it's how many shots usually is given to the children? Adults, we give only one shot, and it's
In
enough.
children, any child under age 9 years, when they get their flu vaccine for the first time in their life, we give it twice, 1 month apart. After that, only like in adults, once a year before
Right.
the flu season.
But how about the young children? 6-month-old?
Young children, we cannot give the flu vaccine before 6 months because they don't have enough immunity to develop antibodies. Starting at 6 months, we give one vaccine from 0, and then a month later we give the second vaccine.
So within 1 month they get 2 vaccinations.
And after that,
Once yearly
subsequent
vaccination.
years, they get only
Right.
one vaccine a year.
And if they didn't get the vaccination and they come with flu, we have the treatment for them. So what kind of medication you give to the child?
Even in young children, even in babies, we can use Tamiflu. The main point I want to make with Tamiflu is it has to be started as early as possible. Once the child is sick for 3-4 days, and even if you know the child had flu, it doesn't seem to work as much. It's important to use it within the first 24 to 48 hours for it to work.
And it's the same for adults. We would like everybody to get vaccinated for flu. And the treatment is, if they didn't have vaccination and they have the flu disease, then we give the Tamiflu the same as children get it. And it's very important, as Dr. Baydar says, within first 48 hours is the most important thing, that you start Tamiflu. After 48 hours, we don't give for adults either, because the effectiveness is not there. Dr. Baydar, thank you for coming to our program and enlightening us about antivirus and the flu vaccination.
Thank you for having me.
Now it's time for this week's article. It is about insufficient sleep and obesity. Normal sleep is 7 to 8 hours a day. Lack of sleep or sleep deprivation causes obesity. Several studies have confirmed the relationship between sleep deprivation and obesity. They have demonstrated the changes in insulin sensitivity and its effect on fat cells. Insulin sensitivity is 30% lower with sleep deprivation compared to normal sleep. This means that we deposit more fats in fat cells around our abdomen and increases our chance of obesity. As you know, obesity increases the chance of heart disease, high blood pressure, type 2 diabetes, and some cancers. So try to get your 7 to 8 hours sleep every day. If you have insomnia, decrease your caffeine intake, drink some chamomile tea and or glass of warm milk before bedtime, and consider taking melatonin. Good health is precious. Stay informed by visiting AAHPO's website, AAHPO.org. I'm Dr. Ohan Karatoprak. Until next program, so long.